High blood pressure. It's often called the silent killer, and for a profoundly critical reason. Unlike many ailments, it offers no immediate pain, no glaring symptoms to warn you of its insidious progression. For countless seniors, this condition stealthily advances, its dangers accumulating in the quiet background until a life-altering event, a stroke or a heart attack, abruptly thrusts it into the harsh light. What makes it profoundly more perilous is the ease with which we overlook the very habits that subtly fuel its rise. Every single day, seemingly simple choices, what you eat, how you move, how you manage stress, influence your blood pressure more than you might realize. The reality for many over 50 is deceptive. On the surface, they appear to be following all the right protocols, diligently taking their medications, attending regular checkups, and making genuine efforts to stay active. Yet, concealed within these seemingly healthy routines are subtle, often invisible missteps. These aren't overt blunders, but rather deeply ingrained habits that, though appearing harmless, relentlessly nudge blood pressure higher or inadvertently sabotage the effectiveness of crucial treatments. And unless someone points them out, they continue unchecked, quietly putting immense strain on the heart, the brain, and the entire circulatory system. This is precisely why this video isn't just another health segment. It's a vital resource. Our aim isn't to overwhelm you with complex medical terminology or to shame anyone for past habits. Instead, we're here to offer unwavering clarity, illuminating the most prevalent blood pressure mistakes commonly made by seniors. More importantly, we're providing simple, practical, and highly effective changes that can yield truly significant results. Whether you've navigated the complexities of hypertension for years or are just beginning to monitor your numbers, this comprehensive guide is meticulously designed to empower you. It offers a path to reclaim control of your health in a manner that feels entirely doable, genuinely encouraging, and undeniably smart. Because blood pressure management isn't just about numbers on a screen. It's about staying active, thinking clearly, sleeping well, and enjoying life with confidence. And that starts with knowing what to avoid and what to do instead. So, let's dive into the first blood pressure mistake and start building a stronger, more stable foundation for your heart health, one smart habit at a time. Mistake number 1. Skipping medications or taking them incorrectly. Our first crucial error, and arguably what's absolutely crucial to grasp, is that these medications often don't deliver an immediate, palpable sensation of feeling better in the way some other medications might. You might not notice a direct improvement in your daily comfort, and this very subtlety can make it dangerously easy to underestimate their profound importance. Yet, beneath the surface, they are tirelessly performing critical, life-preserving work, easing the immense pressure on your heart, significantly improving your overall circulation, and dramatically reducing your risk of experiencing life-altering complications. The truly encouraging news here is that this specific mistake is entirely preventable. The foundational step is to transform medication intake from an intermittent question mark into an unwavering daily routine. Commit to taking your medication at the exact same time every single day, leveraging readily available reminders like pill boxes, smartphone alarms, or simple daily checklists. Should you ever inadvertently miss a dose, never double up without first consulting your doctor. Immediately call their office and seek their precise guidance. It's also worth discussing affordability concerns with your healthcare provider. Many seniors try to stretch prescriptions because of cost, but there are often generics, discounts, or assistance programs that can help. Your health is absolutely worth that conversation. Managing blood pressure is a long-term commitment, but it's one that gives you more energy, stability, and peace of mind. And it all starts with consistency. One pill, one day, one decision at a time. Your heart is counting on you to stay on track, and so is your future. Mistake number 2. Eating hidden sodium. Our second common misstep, and a truly deceptive one, is eating hidden sodium. You might pride yourself on rarely reaching for the salt shaker at mealtime, yet that commendable restraint doesn't necessarily mean you're effectively avoiding sodium. In a surprising revelation, the vast majority of salt consumed in a senior's diet isn't from what's visibly sprinkled on top. Instead, it's insidiously hidden within the processed and prepared foods we consume every single day. One of the most prevalent and consistently overlooked errors in blood pressure management is a profound underestimation of just how much sodium subtly infiltrates your daily meals. High sodium intake is directly linked to high blood pressure. Salt causes the body to retain water, which dramatically increases the volume of blood in your vessels and places extra, damaging pressure on artery walls. Over time, that relentless pressure wears down the heart and can lead to stroke, heart heart attack, kidney damage, or other serious health problems. But because the effects are silent, it's easy to dismiss and even easier to forget where salt is hiding. The culprits are widespread: packaged foods, canned soups, sauces, frozen dinners, various breads, and deli meats. Even seemingly healthy choices, such as low-fat salad dressings or whole-grain crackers, can be surprisingly laden with sodium. That means even moderate sodium intake can lead to bigger increases in blood pressure than it might have decades earlier. It also increases fluid retention, which can worsen conditions like swelling in the legs or congestive heart failure. The critical first step in rectifying this widespread mistake is cultivating acute awareness. Make it a non-negotiable habit to meticulously read food labels, not just for calories or fat content, but, most importantly, for sodium levels. You'll likely be astonished by the unexpected places where it lurks. Consider this: a single serving of canned soup can potentially contain more than half of your entire daily recommended sodium intake. Even seemingly innocuous items like a slice of bread or a serving of cereal can contribute significant amounts if consumed regularly. Your goal should be to actively seek out products explicitly labeled low sodium, meaning less than 140 milligrams per serving or no added salt whenever feasible. Practical steps can also make a huge difference. Rinse canned beans and vegetables to wash away excess sodium. Choose fresh or frozen foods without sauces. Cook more meals at home where you control the ingredients. Use herbs, spices, lemon, vinegar, garlic, or pepper to add flavor without salt. Over time, you'll find these options not only protect your heart, but actually enhance your meals. And yes, retraining your taste buds takes time. If you've relied on salty foods for years, lower sodium options may seem bland at first, but your palate will adjust. Within weeks, you'll start to taste the natural flavors of foods more clearly, and you may even find that highly salted foods become too intense or unpleasant. Cutting back on sodium doesn't mean giving up. Every bite becomes a step toward balance, and every meal becomes an opportunity to nourish not just your hunger, but your well-being. Mistake number 3, not monitoring blood pressure regularly. Our third crucial error, often leading to unforeseen dangers, is not monitoring blood pressure regularly. Blood pressure, in its deceptive nature, isn't something you can typically feel. You won't sense its subtle shifts until it reaches dangerously elevated levels or culminates in a severe medical event. This insidious silence is precisely what makes it so misleading. You could be moving through your day, feeling perfectly fine, even robust and healthy, while your blood pressure silently escalates. For seniors, one of the most prevalent and high-risk missteps is neglecting regular blood pressure checks, or worse, relying solely on an annual doctor's visit to keep tabs on this vital metric. Without consistent, diligent monitoring, even minor fluctuations go unnoticed, and it's these seemingly insignificant changes that can quietly lead to profound and severe consequences. The undeniable truth is that your blood pressure is in a constant state of flux throughout the day. It responds dynamically to an array of factors, including stress levels, sleep quality, dietary choices, and your physical activity. A solitary reading at the doctor's office, even if it appears perfectly normal, offers only a snapshot. It simply doesn't paint the full picture. Furthermore, those clinic readings can often be misleading. They might be falsely elevated due to white coat syndrome, nerves, or deceptively low if you're having an exceptionally good day. This is precisely why at-home monitoring is an incredibly powerful tool. It provides you with a far more comprehensive and accurate understanding of your blood pressure trends over time, and this invaluable insight can be literally life-saving. When you don't track your blood pressure, you miss valuable clues. Maybe your medication isn't working as well anymore. Maybe a new food habit or stressor is starting to take a toll. Maybe a supplement you added to your routine is interfering with your prescription. Without regular readings, you're left guessing. And when it comes to your heart, guessing isn't good enough. Monitoring your blood pressure at home is one of the simplest and most empowering habits you can build. It allows you to spot patterns, catch spikes early, and give your doctor the crucial data they need to make better decisions. It also helps you take ownership of your health. You're not just waiting for results, you're actively shaping them, one reading at a time. Checking your blood pressure isn't just a task to cross off a list. It's an ongoing conversation with your body. And like any good conversation, it works best when it happens regularly, calmly, and with care. Make it part of your daily rhythm. Make it a habit. And most importantly, make it a priority, because your future depends on the choices you make today. Mistake number 4, letting stress go unmanaged. Our fourth critical mistake, often overlooked yet profoundly impactful, is allowing stress to go unmanaged. Stress isn't merely an emotion you experience. It's a tangible burden your body carries, deeply affecting its physiological functions. While we commonly attribute high blood pressure to dietary indiscretions or insufficient exercise, exercise. One of its most significantly underestimated contributors is chronic, unrelenting stress. For seniors, failing to effectively manage stress isn't just detrimental to mood and sleep quality. It's a silent, relentless force that consistently, day after day, incrementally pushes blood pressure higher. Stress activates the body's fight-or-flight response, flooding your system with hormones like adrenaline and cortisol. These chemicals temporarily raise blood pressure by tightening, but ignoring stress doesn't make it go away. It just gives it more time to settle into your system, draining your energy, shortening your patience, and quietly spiking your blood pressure. The truly encouraging news is that effective stress management doesn't necessitate drastic life overhauls or costly therapies. It begins with small, intentional actions designed to gently calm your nervous system and guide you back into a state of physiological balance. Deep breathing exercises, for instance, are remarkably effective at slowing the heart rate and promoting the relaxation of constricted blood vessels. Gentle, consistent movement, be it a leisurely walk, a calming yoga session, or simple stretching, releases accumulated tension and stimulates the production of mood-lifting endorphins. Spending quiet time immersed in nature, listening to soothing music, or engaging in gratitude practices through journaling or prayer can profoundly reset the body's stress response. Even the simple act of confiding in a trusted friend or openly one breath, one walk, one moment of stillness at a time. Mistake number 5, ignoring physical inactivity. Our fifth crucial mistake, and a surprisingly impactful one, is ignoring physical inactivity. When it comes to diligently managing high blood pressure, what you fail to do can carry just as much weight as your deliberate actions. One of the most consistently overlooked, yet profoundly influential, errors seniors make is underestimating the dangers of physical inactivity. This essentially means prolonged periods of sitting, insufficient movement, and the erroneous assumption that complete rest is always the optimal medicine. While adequate rest undeniably has its place, a persistent lack of physical movement can insidiously, silently, yet powerfully push blood pressure higher, compelling the heart to work far harder than it naturally should. Physical activity helps regulate blood pressure by strengthening the heart. A stronger heart pumps more blood with less effort, which significantly reduces the force on your arteries and helps keep your numbers within a healthy range. Exercise also improves circulation, reduces inflammation, supports weight control, and lowers stress, all key factors in robust cardiovascular health. But when consistent movement disappears from daily life, the body starts to lose its efficiency. Muscles weaken, circulation slows, and pressure inside your blood vessels begins to rise. For many seniors, the challenge isn't motivation, it's uncertainty. Concerns about joint pain, fatigue, or fear of falling can make the idea of exercise feel intimidating. But physical activity doesn't have to be strenuous to be effective. Even light movement done consistently can produce real benefits. In fact, one of the most powerful changes you can make is simply to sit less. If you tend to watch TV or read for long stretches, try standing up every 30 to 60 minutes. March in place for a minute. Walk to the kitchen. Do a few shoulder rolls or toe taps. These short bursts of movement throughout the day help break up long periods of sitting, which can otherwise stiffen arteries and raise blood pressure over time. What matters most is consistency. Moving your body regularly tells your heart, your blood vessels, and your brain that you're still engaged with life, still active, still strong. And over time, that message becomes reality. It's also important to find forms of movement you genuinely enjoy. That might be dancing, gardening, water aerobics, or a simple stretching routine in the morning sun. When exercise feels pleasant, not punishing, you're far more likely to stick with it. And the more it becomes a habit, the more your body begins to thrive. If you're unsure where to start, talk to your doctor or a physical therapist. They can help you find safe, appropriate ways to move based on your current health and mobility. Remember, this isn't about becoming an athlete. It's about staying independent, keeping your balance, and giving your heart the help it needs to serve you for years to come. Ignoring inactivity may feel harmless, but over time it places unnecessary pressure on your heart and blood vessels. Movement is medicine, and every step you take is a step toward lower blood pressure and a stronger, more confident you. Mistake number 6, overusing caffeine or alcohol. Our sixth common misstep, often slipping under the radar, is overusing caffeine or alcohol. For many, a morning cup of coffee or an evening glass of wine are cherished, seemingly innocuous rituals, and in true moderation, they can indeed offer comfort. However, for seniors navigating the complexities of high blood pressure, the overuse of either caffeine or alcohol represents a subtle yet significant mistake. These substances might not appear immediately dangerous, yet they possess the insidious ability to quietly elevate blood pressure, significantly interfere with vital medications, and ultimately create far more health challenges than they resolve. Let's start with caffeine. Found in coffee, tea, soft drinks, energy drinks, and even chocolate, caffeine is a potent stimulant. It narrows blood vessels and increases heart rate, both both of which can temporarily elevate blood pressure. For some people, this effect is minor or short-lived, but for others, especially those already dealing with hypertension or heightened sensitivity to stimulants, even a small dose of caffeine can push blood pressure into the danger zone. What's tricky is that the effect varies greatly from person to person. Some seniors can enjoy a daily cup of coffee without issue, while others may experience spikes that last for hours, sometimes without even realizing it. The key is awareness. If you drink caffeine regularly, it's worth paying attention to how your body responds. Consider checking your blood pressure before and after your morning brew or afternoon soda. If you notice a pattern of higher readings or symptoms like headaches, jitteriness, or a racing heart, it might be time to cut back or switch to decaf. You don't have to give up your favorite rituals entirely. Just make thoughtful adjustments that support your heart. Alcohol presents a different kind of challenge. In very small amounts, it may seem to help with relaxation, lowering your guard at the end of a long day. But in larger or more frequent doses, alcohol consistently raises blood pressure and can interfere significantly with the effectiveness of medications used to treat hypertension. It also contributes to dehydration, poor sleep, weight gain, and increased emotional stress, all of which negatively affect blood pressure. For seniors, whose bodies process alcohol more slowly, these effects can be magnified and linger longer than expected. Drinking more than one alcoholic beverage per day can begin to shift the balance from occasional indulgence to chronic risk. And combining alcohol with blood pressure medications can lead to a range of serious side effects, including dizziness, confusion, and liver strain. These risks are even greater when other medications are in play, which is often the case for older adults managing multiple conditions. The good news is that moderation, even small reductions, can make a noticeable difference. Cutting back on caffeine or alcohol can lead to lower blood pressure readings, better sleep, more stable energy levels, and improved focus. In some cases, reducing these substances can also reduce the need for additional medications. And giving up coffee or wine doesn't mean giving up comfort. There are plenty of enjoyable, heart-friendly alternatives. Try herbal teas like chamomile, mint, or rooibos. Sip on warm lemon water, or make your own flavored sparkling water with fresh fruit and herbs. These simple swaps can offer the same sense of ritual and relaxation without the side effects. Ultimately, it's not about restriction, it's about intention. Knowing how caffeine and alcohol affect your body empowers you to make better choices. Choices that support not just your blood pressure, but your overall health and quality of life. Your heart doesn't ask for perfection, it asks for care. And each step you take toward balance is a step toward a stronger, steadier you. Mistake number 7, not communicating with healthcare providers. Our final, yet perhaps most crucial, mistake is not communicating effectively with healthcare providers. When it comes to diligently managing high blood pressure, cultivating the right support system is every bit as vital as adhering to medication regimens or making healthy dietary choices. At the very core of this essential support network stands your healthcare provider. Yet, one of the most prevalent and entirely avoidable errors seniors make is failing to maintain open, consistent lines of communication with their doctor or care team. Whether it involves skipping appointments, withholding important symptoms, or simply assuming that things are good enough, a persistent lack of honest, regular dialogue can lead to dangerously missed opportunities and overlooked warning signs. It's easy to fall into a routine of simply renewing prescriptions and showing up for annual checkups. But blood pressure isn't a set-it-and-forget-it condition. It fluctuates with changes in stress, activity level, sleep, diet, other medications, and even the seasons. If your doctor isn't fully informed about how you're feeling or what's happening day to day, they're working with half the picture, and that can make it harder to catch problems early or fine-tune your treatment. Many seniors hesitate to speak up out of fear of seeming difficult, being judged, or bothering the doctor. But no concern is too small if it relates to your health. Whether you're experiencing unusual dizziness, a side effect that you've been trying to ignore, a new supplement you've started, or a recent change in your routine, all of this information helps your provider keep your care plan safe and effective. Medication side effects in particular are one of the most underreported issues. Some people simply stop taking their pills because they don't like how they feel, but they never mention it to their doctor. This can lead to uncontrolled blood pressure, or worse, serious complications. A quick conversation could result in an adjusted dosage, a different medication, or lifestyle changes that make a world of difference. Blood pressure readings at home should also be part of your communication. Bring your log to your appointments or share it through a patient portal if available. Seeing the trend, not just a single reading, allows your provider to understand what's working and what isn't. And if readings are inconsistent, they can help you figure out why. Even mental and emotional health matter in this conversation. Stress, loneliness, depression, and anxiety can all contribute to rising blood pressure, and your provider may be able to refer you to counseling, support groups, or community programs that can help. If visiting the clinic is difficult due to mobility issues, distance, or transportation concerns, ask about telehealth options. Many practices now offer virtual appointments that make it easier to stay in touch without leaving home. Good communication doesn't require long conversations, just honest ones. Your doctor is your partner in health, not a judge. The more they know, the better they can guide you, and you don't have to wait until your next appointment. Conclusion: managing high blood pressure doesn't have to be overwhelming. It doesn't require a perfect lifestyle, an endless list of restrictions, or constant worry. What it really requires is awareness of the daily habits that matter, the signals your body is sending, and the power you have to shape your health one decision at a time. The truth is, blood pressure isn't just a number. It's a reflection of how your body is living, breathing, resting, moving, and responding to life around you. Now you've seen the 7 most common mistakes that often go unnoticed. And more importantly, you've learned how to avoid them. From understanding your medications to watching your sodium, staying active, managing stress, communicating with your healthcare provider, and making mindful choices about caffeine and alcohol. These are all manageable, realistic changes that don't require you to overhaul your life. They simply ask you to care for yourself with a little more consistency and a little more intention. Here at Strong and Sensior, we believe that good health is built one habit at a time. You don't have to do everything at once. Just pick one area to start. Maybe it's checking your blood pressure regularly or swapping a salty snack for a fresh one. Maybe it's setting a reminder to take your medication on time or calling your doctor about something that's been bothering you. Whatever it is, know that every small step you take is a step toward a healthier heart, a steadier life, and a stronger, more sincere you. If you found this video helpful, please give it a like, subscribe to Strong and Sensior for more empowering health insights, and share it with someone who could benefit from a little clarity and encouragement. Because when we support each other, we all rise stronger, steadier, and better equipped to thrive, one heartbeat at a time.